Good afternoon and welcome to our webinar. My name is Bill Riley. I'm a member of the marketing team here at Medical Advantage. On behalf of myself, Deb, and Chad, we'd like to welcome you to our session today. This is our second session related to OpenNotes. This is OpenNotes Tales from the Field. Before we get into our material, let me do some quick housekeeping. Our phone lines are muted today, but we will be pausing towards the end for some questions. Please use the little text bubble attached right on the side of your GoToWebinar panel. Submit questions as you think of them, and we'll take those a little bit later in the session. Let me quickly introduce our panelists today. Chad Anglum is our Vice President of In-Practice Technology Services. Chad is a frequent speaker, panelist at many of our webinars. Thank you, Chad, for joining us again today. I'm sure that many of you attended Chad's prior session on OpenNotes. Happy to see you back, and we're happy to have Chad back again with us today. Deb Sprague joins us. Deb is actually a member of the Medical Advantage marketing team in a senior project management role, responsible for rolling out and managing many of our key initiatives. But in a prior life, Deb worked for a large healthcare system consisting of hospitals, as well as primarily a number, hundreds of ambulatory sites. And one of her big initiatives back in those days was managing the rollout, the planning and the rollout of an OpenNote initiative. So Deb will be representing the voice of the practice, and to a certain extent the voice of the end customer or the patient here today. So more to that in just a minute. Let me do a quick introduction of Medical Advantage. For those of you who may be new, Medical Advantage is a part of the Doctors Company. We fit under the umbrella of the TDC Group. Now, the Doctors Company is the largest physician-owned med-mal insurer in the country. We have roughly 100,000 physicians insured nationwide, over $6 billion in assets. TDC consists of different business units. Medical Advantage is one of those subsidiary companies. We're the only one who's not in the professional liability space. We are providing training and consulting, a whole portfolio of services for physicians, for practices, typically at the point of care. Josh, if we go to the next slide, we can look at our portfolio of services quickly. We summarize them into two buckets, two categories: practice transformation in general, as well as EHR consulting services. More specifically, today we're going to leverage more of our experience from the right-hand column as we talk about the OpenNotes initiative. But in general, we're available. It's Chad's organization that's available to help practices with go-live support with a new EHR, staff training, documentation, templates, forms, cleanup, improvement, EHR reporting, a whole range of services. But anyway, with that as the background, why don't we get into our topic for today around OpenNotes. And with that, Chad, I'll turn it over to you.
Great, thanks, Bill, and welcome, Deb. I look forward to going through some tales from the field today. So many of you I see on the list were on the list early in March when we first discussed OpenNotes and really what it was. And as we know, it's a movement promoting and studying transparent communication in healthcare. So it truly is giving patients access to their notes, and really has proven successful in many of the organizations that we've helped, as well in many of the studies and some of these early on adopters here from 2010 all the way till now. So a few of those groups participated in that initial demonstration study, and patients started getting access to their notes and being able to actively engage in their healthcare. And really what we found is that when patients are engaging in their healthcare, as well as their caregivers being able to be given access and engage, health literacy improves. So if you think back to your most recent doctor appointment, you're in there, you're being roomed, you're discussing what's going on with your clinician. They're then telling you, okay, we're going to do X, Y, and Z, and we're going to get you to a point of feeling better and being more healthy. and then you leave, you pay, you check out, and next thing you know, you're driving home or sitting home with your family, and they're saying, okay, so what's going on? And you only remember 25% of it. And really, that's what OpenNotes is all about. So you can go back, you can take a look at your visit note, and you can have those discussions and start to formulate a plan. And it's really designed to keep you healthier in between visits. So, we also find that medication adherence, every one of you struggle with your patients on medication adherence, and that is one of the big benefits of OpenNotes. They're absolutely more motivated to follow their care plan, and medication adherence is one spot where we see big gains. So getting into what information must be shared. There's going to be a variety of ways to share the information, but what truly needs to be shared is important. And that's everything from your consult notes and your discharge summary notes, which you may have shared in the past through meaningful use, to your H&P, to imaging narratives, to your lab and path reports, your actual procedure notes, and any progress notes from visits with your patient. Now, with any rule, there's exceptions, and the two main exceptions here are your psychotherapy notes, maybe your behavioral health visits, as well as any information compiled in anticipation of a lawsuit. So, what we find is a lot of practices that have started through this process and are now OpenNotes live are very nervous about those sensitive subjects. But what we've actually found is that a lot of therapists that have gone through this over, the past few years have seen, that they can actually catalyze good behavior by sharing and effectively discussing what they document with the patient, and they start to build that trust. I was just meeting with one of the practices that attended my first OpenNotes webinar, and they said, okay, we're live. We've activated OpenNotes through our EHR. We're now sharing notes, but we're still really nervous about the sensitive subjects: weight loss, drug abuse, maybe physical abuse, or a variety of other topics that they just haven't started to open up. And really what we found meeting with other groups that have gone through it is, if you document what you discuss with your patients, you start to build a trust. They start to see that what I'm telling my provider is actually showing in my progress note, and the results have been considerable. So that's something that we recommend. Meet with your team, meet with your providers, start to discuss what are you going to share, and maybe what at first we're not going to share, and then start through a process of opening that up. And I'm sure we'll talk about that a little bit later as well. So getting into our 5-step process. So many of you that attended our last webinar, we talked through educate, plan, prepare, adapt, and learn. No two systems are the same. So Deb's going to give amazing information based on her past in a project just like this at a health system. But just know, you may hear things that are slightly different to your organization. It may be specialty based, it may be size, but just know that there are these 5 steps that really ring true to every organization we've helped properly roll out OpenNotes. So while in some respect it's a really simple intervention, there are many things to consider as a medical practice on how the sharing of visit notes will affect your specific patient base and your staff as a whole.
Okay, great. Thank you, Chad. So with that, Josh, why don't we take down the slides for a minute and let's just talk, give Deb the opportunity to talk a little bit about the project, the initiative she was involved in. So Deb, why don't we start there? Why don't we just let you give your history with the system you're a part of, your role, and what was the initiative that was happening?
Hi, thanks, Phil and Chad. Thank you for having me. I'm excited to kind of be able to share the tales from the field and the story that the healthcare system that I worked with. Again, it was my role. I had 2 roles within the organization, and each of them were incorporated OpenNotes at 2 different times. The first one, I was within patient experience and actually engaged many of the patients within. The system that I was in was one of those earlier adapters. Back in 2010, when this was launching off, I was a part of that work in the front end, engaging the patients and getting their voice. And really encouraging and advocating for OpenNotes. So that was in that part of it. In another role that I was in was actually around implementing the Cures Act through more on the inpatient side piece of it, and then any other areas. When you notice when you're listing out, the system that I was working with, they weren't sharing consult notes, they weren't sharing the procedure notes. So that was definitely a change that we had to adapt with within this past getting ready for the first go around in 2020, adapting it for the 2020 release, and then of course now for April with adapting to the Cures Act. So I was a part of that launch off and work. The first go around of the system that I was working with the early adapters, it probably took a lot. It was much tougher because it was changing the behaviors and getting the buy-in of everybody to be doing this. So there was a lot of work that was involved with that. This last change through the system was a little bit easier because it was the Cures Act. It was really mandating that we had to be sharing this information. So the sell to the providers was a little bit easier in engaging them because, of course, it was federally mandated through this Cures Act. But a lot of great change, a lot of great experience in adapting. And Chad, you were mentioning the leveraging the patient and the family. That's what OpenNotes is for. We definitely really saw a lot of engagement from the organization when they saw those benefits coming through.
Absolutely. And so when you look back at the project, what do you feel like went well? So in terms of the project itself, let's start there with what went well, what were some of the advantages that you saw early on? And then maybe we'll go into what didn't go as planned and some of the surprises that everyone here today who's going through it actively may benefit from.
Well, I would definitely say, some of those things that went well that you were mentioning in the beginning part of patients advocating and utilizing those notes, and that definitely showed true. There were many times, in the first early adoption of when we weren't really quite sure and didn't have those rules, we were blown away by the engagement that patients were having. They were, especially when you think about the system that I was working with, had 150 ambulatory sites, a mix of primary care physicians and also specialties. If anybody was receiving that specialty care, they would be really looking at, okay, what are my blood results? Where are we at? They use that really as their own tool to be managing their blood pressure, managing their any chronic disease, any cardiovascular issue. They would be looking at their blood, their weight, blood pressure, weight. They were using that as a tool and a great communication with the provider in between those appointments.
So Deb, that's really interesting. I think one of the things that I've tried to really push with the team as we're out helping is finding out what the patients think, what they feel, how can we make this better? So you said that you had a lot of positive feedback from your patients. Did you send out surveys? Were there phone calls? How were you hearing back from your patients?
So it was a great mix of even just sharing, and the patients would be coming in. So what does this mean here? Can we, they would be getting the results. I think that was probably one lesson learned as one of the earlier adapters was the timing of results. Now with the Cures Act, it's recommended. It's enforced that you can actually delay anything. So there's a lot of conversations that we had in the beginning of the timing of results and ensuring the workflow and the conversations, but really just the feedback that we were receiving through our patient experience surveys that would be sent out through the practices, through the clinical evaluation. So also even, I think when we first rolled it out, we also did some weekly surveys or patients, or just that questions of, what do you think? How is it working? Are you utilizing it? So the front office staff would often ask those questions.
That's great. Yeah, I found surveys to be so helpful. So that's really interesting. And did you ever survey the staff? I know we're talking more about the patient side right now, but how did staff feel about it as it rolled out?
I think it was, when you look at a major change in a workflow at the time that the OpenNotes was going live, we were also switching EHR, and then also, of course, having to, adhere to that expansion of utilization. So it was a lot of, change that was happening. I would say there was, asking and of course surveying the staff of what are ways that we could be able to make this easier for them. Was always a continuous evolution for the providers. Continuously looking at that workflow, how could it be changing, and how could it be improving for them? So yes, surveys, always checking in through that first go around, then also this past with the OpenNotes go live.
Awesome. So maybe what didn't go as planned as you began to launch it?
And I think we might have a slide actually on that of, what are some of the things that did go well and didn't go well. So if we would even want to, speak to some of those things on, other things that did go well that we really saw, of course. There's the OpenNotes highlights of the surveys. This came from the OpenNotes surveys, and we definitely ring true to the patient experience. OpenNotes, this is the patient's record already. It's, we always, in any of our healthcare, would be like, this is our notes, when it's actually the patient's and the family members' notes. Making sure and kind of shifting that mentality of that, improving patient safety. There were some great stories that always came out of patients reviewing what actually happened, that conversation, and even raising red flags if something didn't go wrong or if something was missed. So that was some wonderful things that did come out of that, was improving the safety. And you always, I know when I'm writing something down, you're always making sure that you're writing it down correctly, because you're going to have somebody else looking at it. So that was a great shift of our providers, nursing, doctors, nurse practitioners, making sure that they were documenting correctly and making sure that everything was down there. So I know our coders found an increase of documentation corrections kind of dipped down a little bit because of that.
And
other things that, yep, go ahead.
Just to add to that a little bit, I think, going in to these different health systems and offices, there's always a big misconception of my patients are going to be upset with me. I'm going to make a mistake at some point. I'm trying to manage a population of thousands of patients and keep them healthy, and I'm doing everything I can to be as accurate as possible, but every once in a while, even I make a mistake. And there's a big misconception out there that a patient's going to be, really frustrated or even leave the practice because they read something that maybe isn't correct. And I think, one thing, and you can probably speak to it, that patients just love the ability to have that open communication and be able to get a hold of the practice either through the patient portal or the phone call and pick up the phone and say, I've noticed a mistake in my note. My clinician and I talked about this, but actually this is in my note, and I know it's probably just a mistake, but I'd like to get that fixed and make sure we're on the same page. So maybe you can speak a little more to that.
So definitely, when you do look at, even, your patient population, those individuals that are always either going to be calling you, and, you have the ones that are going to take a little bit more time and attention, and those are always within your patient population. But I know some of the things that we were kind of looking at and getting prepared for the first go around was a lot of questions or phone calls, or people getting angry about that. I don't believe that we really saw that. So the fears of that perception didn't really happen. It was that engaging in that conversation. And I think that's really the workflow change that we really needed to make sure happened. And the coaching from our lead physicians, where if you're not going to document it, if you're going to document it, make sure you're having a conversation about it. So that really evolved and changed, and kind of didn't, the decreases, we weren't surprised with those phone calls of angry patients as it was perceived.
So Deb, what were the key components within the journey?
So with this, the most recent one, of course, with the Cures Act was really getting ourselves organized for launching off additional components of what was of those additional requirements. Looking at the change management, leveraging that of all of those different principles of, adapting, really kind of finding out what's the motivation of it. The motivation changes, of course, now that this is a little bit more of a federal mandate through the Cures Act. But of course, you're still changing many people's workflows. So being able to still get the buy-in that you're going to be working on some different pieces. Documenting, of course, what is the process that you're doing now that needs to be changed? What are those different nuances that that we made sure that we're adapting to it? So that was one of those things that we had to work through. Who is going to be getting the biggest change, of course, working with them and connecting with them and communicate. Really a lot of the things that the leadership did was the physician leadership was engaging with those other providers and making sure that they were still comfortable with the OpenNotes and being out there and changing. And then of course that follow-up and continuous learning in evolving through that. And that's where I think many of us are at now. Many of the practices on here right now are probably at that point of it's live, now we need to continuously improve it.
Great, absolutely. So thinking through all the change, and a lot of our practices have done, very similar processes and procedures for a long time, and change can be difficult for any of us. So, what would you say were the most difficult changes that you went through?
I would say when we look at for this one particularly was the what could be shared and what not could be shared. So I think that was probably one of the biggest pieces of it. Also with this finding that with this rule is that you have to be prepared for any way that you want to get your patient coming in, you have to meet to their technology needs. So however they want to receive it, that was the biggest challenge. I think the organization's still working on that, and I know many of us are probably still working on if Bob comes in with requesting the portal through the records this way, I have to figure out how to be able to get that to them. Policy agreements and really sharing on those sensitive notes was probably one of those surprises of challenges that how could we be able to help you with those types of pieces, making sure that you're sharing that also on time.
Great, yeah, and we've seen that too, where we put policies and procedures in place for a variety of different ways to request your notes, and that may be the patient may walk in and said I want them printed. They may call in and say I'd like them mailed, or they may say I'd like access to my patient portal now. Whereas in the past they may have said I'm not interested. So just trying to give them access to their notes in a way that is most convenient for them in a timely manner.
I think that was probably the biggest other challenge was that timely manner. It is the information blocking is also the delay of releasing of notes. And what does that mean? In ensuring that your EHR, if you're sharing it with your patient portal, that was a lot of things that we had to work on the back end that there were some tests that we were holding back. Now you can't do that anymore through the blocking, information blocking piece of it. So that was a lot of work that had to change, especially for the results, the consults, and those types of areas that are now mandated to go live was probably some of the other bigger changes that we were surprised with and had some struggles with.
Great, yeah, and I see working with a company, either like your EHR vendor or a company like Medical Advantage, to come in and actually pre-build and set up the system for success, because most commonly it's going to be the patient portal that you're going to utilize as a delivery channel for OpenNotes. And we found that going through doing all the pre-build, ensure the EHR is completely set up for success, and that your clinicians and staff all the way from front office to back office within your organization understands what's being shared and how it's shared is so important. So getting that all set up in advance, setting up test patients, ensuring that what you expect is what's being shared is really paramount to doing this the right way. So, looking back to feedback, we talked earlier, we had a great discussion on patient surveys and all the positive stuff you were hearing back from patients that took advantage of being able to access their record. Did you ever track utilization? That's something that always interests me. And you talked earlier, you referenced different age groups that were accessing their patient portal specifically, but did you track utilization in terms of, okay, we went live on OpenNotes, here's who is actively using their notes or logging in to view their notes, and as a part of that, did you look at any proxies or caretakers?
Most definitely. There was a fantastic team that worked in the IT space that really leveraged the patient portal, and were tracking that on a weekly basis of how many patient portal signups were happening, how many folks were utilizing it, how many times they're opening it, the emails push through that you have a notes. A lot of that data was being tracked through the EHR and through the patient portal. To be able to ensure that they were utilizing it the right way. Other challenge, when you do look at some of the surprises and challenges in patient portal utilization and that proxy access, that was something that I think the front staff had to be really, a lesson learned was making sure that they knew how to train somebody on how to get the proxy access. If my mom was going in or my grandma was going in, I would want to make sure that I'm getting that proxy access for her to make sure that we're managing the care. I think that was a surprise that we had from our front staff of making sure that Deb knew how to get into grandma's portal. But there was definitely an increase in the patient portal. The patient population that also was a challenge where we had to really work out, and that's something that was a surprise for us continuously when we first rolled this out, was the pediatric population. When you have some kiddos that are pretty sick and their parents are the ones that are managing their care, how can you be able to grant access to that patient population and for that parent to be able to gain access? So managing the state laws of proxy access, especially for those teenagers, was a very difficult thing to manage through and walk through. And so having that front office be able to approve proxy access for parents was some of the lessons learned for us.
Absolutely, and that is something that I think our team really brings to the table in working with our groups, is all those types of policy issues that, if you haven't gone through a project like this before, you may not be aware of. So we really try to focus on ensuring that our clients are all educated on what to do and maybe what not to do as they roll through this. And I think it's not discussed enough on how much the weight of this really is on the shoulders of every single employee within the office to have an elevator speech and be able to say in 30 seconds or less why it is important for the patients to access their health record and the advantages around it. And all the power of the patient portal to get them on the portal and actively engaging in their healthcare. And in a world now where many of us are going to value-based reimbursement and value-based contracts, it's imperative that our patients are being active in their healthcare between visits and not just when they're seeing us, or not like the typical dental appointment where you're flossing the day before for the first time in 3 months. We want you involved in your healthcare for the entirety of the year, and this is a big piece of that. And being able to have an app on your phone and access to your patient portal, whether you're taking care of your 3-year-old or you're in your 90s, and you're able to log onto the portal and know where you're at, and being able to follow through and adhere to all the recommendations of your physician. So, you know, Deb, as you've gone through this, what recommendations do you have for others that, you know, maybe managing an office or may have been tapped with this in their health system?
So I think, you know, the post go live, everything is out there and everything is, we're celebrating, it's out, it's still going. And just as you were mentioning, Chad, the goal is to utilize, it's the patient's record, it's the family member's record, and you're going to continue on in managing the care. What we saw from the first launch of OpenNotes to even now for the past one within that project is having to continuously educate and bring awareness, and all the staff members using that elevator pitch. I may go to my primary care. I'm a healthy person. I only go there, you know, once a year, or if I have an earache. So a lot can change on how you're rolling notes out or providing that information. So just because it's getting sick to you as the provider of saying, do you have OpenNotes? Do you have access to the portal or to the staff member? It's new to me as a patient. And I think that was something that we continuously were surprised at, of like, Bob, you don't have your portal yet. But yeah, Bob hasn't been here in the past 11 months. So that's what I would encourage, that continuous education and that engagement of the patient and family, because they do utilize it. That would be one thing. And then also, you know, when we look at the pushback from the patients, how can you make sure that you're engaging your patients in that manner? And then also the proxy access, leveraging that, I think is a true value of enriching that relationship with the patient and the family member.
Great. And it's funny, all those points you just made show the benefits of having a patient portal active in your practice.
Yep.
And obviously there are a ton of ways to do this. You can print notes, you can mail notes, you know, you can electronically share notes, but it all comes down to having the patient portal active. And think about all the benefits that, you know, to your practice, and you're probably completely overwhelmed with everything going on right now. You know, we're going through a pandemic. And there's phone calls coming in every day, sometimes hundreds of them in some of our practices, just asking when they can be vaccinated. So there's always something going on that makes your office very busy. If you get patients to buy into utilizing their patient portal, it not only helps OpenNotes, but it also helps with your practice flow and having to not be on the phone and have you know, 3 or 4 patients on hold at the same time. So if you're starting to drive, and that's everything from the medical assistant to the physician when they're seeing the patients, to, you know, check-in, check-out staff, to billing, to referral management. I mean, all those different positions can benefit from a patient properly utilizing the portal. So there's a ton of advantages to this, not only just with sharing OpenNotes and getting them access to their health record, but also just engaging with the entirety of the practice without having to pick up the phone. So
exactly.
So Deb, I was wondering if you could just go through maybe a few of the lessons learned as you went through this project in a prior life.
So definitely some of the surprises and lessons learned. We'll just I'll do a high level overview of some of them. You don't know who you'll be very surprised on who actually utilizes the notes. You may think it may be the 50, 40-year-olds or the Gen Xers that are out there utilizing the notes, but it's really, we were even surprised when we were rolling this out that it was the 70-year-old, the 80-year-old, and then even I had a 90-year-old coming into me, and she was showing me even how to use it even more so. So it's, be surprised with that and make sure that you're keeping your options open, I think was definitely the change in workflows. I know I've talked about this, but that was, some of those surprises and that continuous evolution, even now that it's in practice and it's live, how can you be able to really ensure that you're having those good conversations with the patient prior to? I think that was definitely a lesson learned for for the organization was shifting that I'm going to document. If I'm not documenting, if I'm not having a conversation with you, then I shouldn't be documenting it. And of course, that patient-friendly focus, but not changing it up too much where you're discrediting the medical, validity of the information. But of course, there's templates that can be used for some of that. We can make it a little bit more patient-friendly. Of course, having that document out there. And then I think that continuous promotion and education of that, the policies and processes, how to be able to share in other platforms. I know is a challenge right now with this Cures Act is that you have to adapt to whatever platform that I may walk in the door. That was probably one of the biggest challenges that the organization went through of how we could be able to do that. And I think is still being worked through. And then of course, requesting that access and requesting that change was a piece of that. Continuously promoting. I think even too, when we looked at the processes and the policy around what not to share, that information blocking, there is still that, that piece of this where anything that is deemed harmed to the patient, there was a lot of conversation around, well, what does that mean? What does that look like? So there was a lot of conversations back and forth, even within different areas. Chad, as you mentioned earlier, around very sensitive topics, how do you document that still in the patient's chart, but not have to share that? There was having a policy developed and agreed upon by all the providers of, okay, this is definitely deemed as harm to the patient, and how do we not have to share that? But like you mentioned, some of the offices that we worked with were behavioral health ones, and they did see some great benefits of, okay, we're documenting this on our medication, this is what we're doing, this is our next steps. That being shared and that progress was very beneficial to those patients. But of course, you need to be also careful of some sensitive harm to the patient, and you want to be mindful of that.
Absolutely, and I think I talk in the first webinar on, I would say that the heaviest lift of this whole project is getting your policies and procedures in order. And when my team engages in this with each new practice that we sign up, we find that there typically aren't policies and procedures in place related to a lot of these changes, even even prior to OpenNotes. So, and with so much staff turnover in the industry, every practice battles that. So, and we find that different employees handle requests differently. And this is just a great time to get everyone on the same page and start to look through, run a gap analysis on how it's being handled currently, and how it will be handled. So maybe a patient calls and says, I found a mistake in my progress note. And how will you handle that as a practice? And that's all the types of stuff that we're doing right now with groups, getting them from the point of, well, this person does it one way, but then this person does it another way, to everyone knows what's expected of them, and it's done efficiently and effectively to best serve the patient. So no, I think that was a great point. I think all those lessons were really good, but I think getting in and digging in now with practices that are launching this, they're really finding that having their policies and procedures laid out and having all the stakeholders, all the staff members buy in and realize what they're supposed to do if something comes up is paramount.
Exactly. And it's those one-off situations that you may not have every single time, but it may be that sensitive piece. And I think that was a lot of the things that the providers walk through, especially within our specialty care, behavioral health areas, and even in primary care, as many are behavioral health issues or psychological issues are coming up, even in through behavioral health. How do you document that kindly? How do you document that passionately, compassionately, and with empathy, but still true, and having that transparency with the patient? That's probably was the biggest, chunkiest piece of that documentation and that change in documentation.
And there's no doubt that that's where I've seen most of the questions come, post our first webinar on OpenNotes was on sensitive subjects. So we've built out a pretty decent database on how to handle a lot of those types of situations just based on requests and then experience in the practices. So I can absolutely see that.
Yeah.
Okay, very good. Very good. We're starting to get a little long on time here, but I would like to take some questions. We've had a few come in. So let me just get to, and for those of you that have submitted questions, if we don't get to them here, I promise we'll follow up offline. But Chad, one for you specifically, as you implement these kinds of capabilities with providers, what are you seeing? You know, we've heard, to kind of paraphrase here, we've heard Deb's example, her story, but you know, what are you seeing as bottlenecks with the clients you're supporting?
Yeah, great question. You know, I would say the biggest bottleneck we're seeing is when organizations don't have all of their stakeholders buy in. So I mentioned earlier the word stakeholders. So I'm talking every single employee of that practice buy into this process. These are the advantages of OpenNotes. Yes, it's something mandated that we have to follow, but you know, here's the good that comes from OpenNotes, and start to get them to buy in and get everyone to memorize that elevator pitch and why it is advantageous to your patients. And you know, I think the biggest bottleneck is when one or two staff members try to just push this out the door to get it live, but really haven't spent the time to educate everyone within the walls of the practice on the benefits of OpenNotes and how it can make you know, make your practice better. So that's one of the biggest bottlenecks I see, Bill, is when everyone isn't, you know, brought into the fray, or everyone hasn't bought into the process. You start to see, you know, issues where somebody doesn't know what to do, or a patient brings it up and says, I'm having a problem, and you know, somebody says, I'm just not sure what you're talking about, or yeah, I have nothing to do with that. And then the patient just feels discouraged, like they were excited about it, they brought it up, and it was squashed. And we saw this 10 years ago with the implementation of meaningful use, where we were helping organizations start to do visit summaries and get it live on their patient portal. And we would literally hear staff members say, just because they were completely overwhelmed and haven't been brought into the proper meetings or brought up to speed on what's going on, we would hear them say, that's just a government mandate, I'm not sure. And you know, or it's something Obama made us do. I mean, it was, we were hearing this, all these different things, and really it always came back to they just weren't involved in the process. So really focus on involving your entire staff, set up training. And I know these are some of the things I went through in the first webinar, but you really have to follow that 5-step process to ensure that when you go live with this, everybody's aware of exactly what you're doing from A to Z. So I would say that's the biggest one, Bill, is buy-in and engagement.
Okay, and then one more quick one here. I think it relates kind of to what Chad you were just saying, but Deb, maybe you can address this. I'm an office manager. We're a 3-physician practice, so don't have a huge staff or team or resources. What would be your best advice?
I think, as Chad even alluded to, engaging everybody in this, and definitely seeing the value that it brings to your relationship with your patients. That was the intent of OpenNotes, is to engage and deepen the relationship and include patients into their care. So that's the true sense of it. So even within that 3-provider practice, the goal is to be able to deepen your relationships with your patients and your family members, and you know, making it simple, making it easy, meeting the patients and where they're at, if they want to have a printout or if they want it electronically, trying to make it as easy and simple as for your patients and for your team.
Okay, terrific. Josh, if you can go to the next slide quickly. Chad, I know we've been hitting on many of these points as we've gone along here, but are there any additional points you'd like to make in terms of how we can help?
Sure. Yeah, and like I said, we have consultants out in the field all across the country assisting organizations to properly implement OpenNotes. So a few of the points here is we have the experience. We know that much of this is EHR dependent. So it makes it a whole lot easier if you have your workflows set up, your policies and procedures, and everything's flowing from back to front. So getting your system set up for success, getting your portal set up, getting the EHR, the documentation, the visit types, I mean, everything set up properly so that when you're sharing information, everything is neat and tidy with your patients and you're not dual documenting things or contradicting things in notes. And we see that a lot with templates that have been built maybe in the past, and you're trying to edit them. Maybe you don't have the technical knowledge on staff to make the updates that you need. So you're finding yourself as a clinician going back and maybe erasing stuff that you're bringing forward. And we just eliminate all those unnecessary steps as a team, and we help you set up your system for success. We understand the cures ruling. We understand that the main goal, as Deb just said, is to stop information blocking. So we're helping you open up properly so that you're going to limit risk and your patients are going to be able to take a much more active role in their healthcare. So, and lastly, I will say, as Deb said, it is so important to understand proxy access, especially with your pediatric practices. And this is something that we've done, like I said, for 10 years with our pediatric groups due to meaningful use. And when to activate patients, when to deactivate their parents or their proxy, and how that works, and what type of documentation you need signed in order to share. And there is a lot that goes into it, and just helping you understand how to properly roll that out is something that our team really takes to heart, and we take pride in walking you through each one of the steps to success with OpenNotes.
Okay, fantastic. So Josh, on the next slide, as we start to wrap up, we have contact information for Deb and Chad. If you are interested in following us, we do any number of these sessions each month, and we typically are promoting them through our social channels. So please follow us, LinkedIn, Facebook. We've also just announced or launched the Medical Advantage podcast. So check us out there wherever you get your podcast. We've got topics on EHR, OpenNotes, any number of other topics. Also in our blog section of our website, insights and resources, we've got articles, we've got recordings of past webinars. So you can check us out there as well. So one final point as we wrap up here. First of all, thank you all for joining us today. As soon as we end, you'll see a survey that pops up on your screen. If you could please just take a moment and give us your feedback, we would greatly appreciate it. So with that, Chad and Deb, I think we're out for today. Thank you both. Great job. And to you, our audience, thank you for joining us. We hope that you found this session helpful, and we hope to see you at a session again in the future. Thanks a lot.